Hi there. This discussion is about evidence-based practice. When we are talking about nursing research, oftentimes we are just thinking that we are here to make researches. But as healthcare professionals and practitioners later on, it is also our part to utilize this research to form part and parcel of evidence. That's why we're learning about evidence-based practice. I just would like to say that this recorded lecture is intended for Level 3 students of the Bachelor of Science in Nursing program. This lecture does not constitute medical advice or imply research-based evidences. Parts of the discussion may not be suitable for the general public. This is a supplementary material and is being augmented by live sessions to reinforce the understanding of the concepts. If there is any, the views expressed in this presentation are my own and do not represent that of the opinion of any entity whatsoever with which I have been, am now, and will be affiliated. The photograph, videos used in this presentation belong to the respective owners, authors, and website. No copyright infringement is intended, and concerns regarding this presentation may be emailed to gjsporque@gmail.com. I would like also to say that these lectures, and along with the other lectures in nursing research, are reference to the following books: Ardales in 2008, Barrientos Tan 2011, David in 2005, and then Pollitt and Beck in 2012. These are the major references. Now, let's talk about evidence-based practice. When I say evidence-based practice, we could not delete the name of Dr. Archie Cochrane. Okay, so Cochrane, she is a British epidemiologist. He is concerned that evidence was not being critically examined. So according to him in 1971, there are a lot of evidences that is being used in clinical practice, or there have been an emergence of several researches. But Dr. Archie's concern here is that the evidence may not have been critically examined, meaning there may be lapses in the evidence, there may be a wrong way of stating the conclusions. So, this is concerned that the evidence is not being critically examined. And he stressed that the random clinical trials is considered to be the gold standard for generating reliable and valid evidence. So take note of his term, gold standard. Now, when I talk about Cochrane or Cochrane reviews, this refers to the electronic database that is consists of systematic reviews in healthcare fields. Okay, so the instruction to open your Cochrane might come from your different respective institution. So when I talk about systematic review, this includes randomized controlled trials, or the systematic review of your randomized or your RCTs of healthcare should include the dissemination of this review. And then, other than that, you should be able to determine the most reliable evidence and its effect on healthcare. Okay, so you need to pick the most reliable evidence, not because somebody has conducted a research on the use of banana, for example, as a bed sore, as a candidate for bed sore. Okay, are we supposed to follow it? Okay, so you need to determine the most reliable evidence and its effects on healthcare. What is evidence-based practice then? We've been talking about it, so what does it mean? When I talk about evidence-based practice, it was first used by Guyot, according to Column, and his advocacy was evidence from clinical research being above intuition and systematic clinical experience and pathophysiology. If you would look at the terms intuition and systematic clinical experience and pathophysiology, this is how our profession used to have a basis when it comes to the practice being done to the patients. But this time, we are seeing evidence-based practice, so we could not base it on intuition. We could not base it on the expertise of an old nurse. We could not base it on the pathophysiology given on the books. But instead, we need to look for evidences as to how or what our patients are experiencing. So evidence-based practice could be the best quality care to patients and their families. And when I say evidence-based practice, it is coupled with an outcome, and that outcome is the utilization of the research and then the change in practice because of the research that was done or disseminated. Now, there are 5 key steps in the evidence-based practice process. 1. The formulation of a clinical question. What is it that you would want to know? For example, I would want to know what is the effective treatment or prevention, for bed sore. And then I would gather the best evidence. When I say gather the best evidence, I will be looking into reliable sources online. Let's say, for example, you'll have your Cochrane database, you'll have your CNAL, okay, and then you'll have other references to look into to gather the best evidence. Next, critical appraisal of the best evidence. So when I say critical appraisal of the best evidence, you will be looking into, is this evidence valid? Is this evidence useful? Is this evidence usable for my purpose to answer the clinical question? And the next is to integrate the evidence with the nurse own expertise. So you would try to integrate the evidence on your own practice. And then after that, evaluate the practice change. So if you would look at the steps, students, first, to answer your clinical question, you did a search. And then after you did a search, you try to inquire, you try to check whether the products of your search are useful, reliable, based on existing models and criteria. Then after that, you would try to integrate already or practice this evidence that you have gathered. And then you will evaluate later on. Notice that just like your nursing process, you still need to evaluate whether the evidence is effective or not. Because it does not imply that once a study has been done abroad and then it's effective among the respondents, it will also be effective in our setting. Okay, that's a major consideration that you need to remember. Other than that, you also have your PICOT format. So when you talk about PCOT format, your PCOT format was actually advocated for by Millink and Finicott Overholt. So in asking your clinical questions, you need to have your PICOT. Okay, so if you would want to know whether a study is applicable in your setting, or if you would want to search about a certain study or evidence available online, PCOT is one guide that you can use. So P is patient population. This patient population must be clearly described and the setting the most relevant evidence. I, intervention of interest. What is the treatment? What is the exposure? What is the diagnostic test or perception that you will be checking on? So specifically, what intervention will you be checking on? That's your intervention of interest. C, comparison intervention. So when I say comparison intervention, it's a standard of care compared to a new treatment or procedure. So it's standard of care. Okay, so I, intervention earlier, that's your treatment. When I talk about your C, that's your comparison or intervention. Ang comparison or intervention would be true control, or it could be also your placebo. Okay, an example of comparison intervention will be your true control or placebo. Then you would check the outcome. When we say outcome, it refers to the outcome variable that is investigated on. So let's say, for example, you are looking for what is an effective intervention for the prevention of your bed sores. If I would look into the outcome, maybe the outcome that you'll be checking is, was there really bed sores or was there no bed sores at all? So that's the outcome that you will be looking into. T is time target. When I say time target, where is the specific time the intervention to achieve the best outcome? Let's say, for example, when you're talking about bed sore management, it does not mean that when an intervention is done, it will be right away effective. So you need to check, how long do I need to apply this lotion? How long do I need to apply this ointment to prevent bed sores? It does not mean that since one intervention is effective, it will be effective if you will use it for 5 minutes, 10 minutes, or 10 minutes, 20, or 1 hour. You need to be able to see in the research that you are looking into if what is the time duration that it will be effective. Okay, so try to recall your PICOT, commonly your PCOT format. So you have your patient population, intervention of interest, then you also have your comparison, outcome, and then time target. Now let's talk about the nature of evidence-based nursing practice. When I say evidence-based nursing practice, there are 3 factors need to be considered. 1, client preferences. 2, clinical experience and expertise. And then third, research-based information. Let's talk about client preferences. When I say client preferences, this could be the request or the needs of your patient based on their clinical condition. Okay, so it could be that your patient has cough, how to prevent cough. It could be that your patient has an increased transmission for COVID-19, so how to prevent transmission of COVID-19. Next, clinical experience and expertise. When I say clinical experience and expertise, that would refer to the mastery of skills by the nurse. Okay, commonly, this is oftentimes related to your related learning experiences or your RLE, especially if you are a novice nurse who is just starting on their practice. So you'll have your clinical expertise. Maybe that would be your clinical eye that you have gained from your experiences, clinical experience that you have honed or you have improved along the years. Okay, so that's your clinical experience and expertise. Then you would have your research-based information. For research-based information, that will be data reflective of the findings of research. So these three elements would result to nurse best practices. So as you can see, when you are applying evidences, it does not mean that you will just concentrate on the evidence-based practice. You need to look into the preference of your patient. You need to look into your experience and the research-based available information. Okay, what do we mean by that? For example, if a new drug could be administered to prevent fatalities on the part of your patient, we do not right away jump on the application of this drug. We need to assess our patient as to when and where his needs would be compatible with the one the drug is addressing to. Next, the next question is, are you as a nurse capable of administering this drug? There may be new techniques, okay? There may be new techniques that is needed to be learned to apply a specific medication. So you also need to check on that. Next, there are three levels of evidences. Okay, when we categorize our evidence, there are three levels of evidence. Okay, so level 1, 2, and 3. So when I say categorization of evidence, it does not again mean that once there is an evidence existing, we'll right away implement it. We need to check whether it's level 1, 2, and 3. The likelihood that we will use level 1 is more likely compared to that of level 2 and level 3. Look at this, level 1. Okay, it's from a clinical trial, meaning it is from a controlled condition. Okay, it's from a controlled condition. There are randomized clinical trials. 2. It will be evidence obtained from well-designed control trials, however, it lacks randomization. So when it lacks randomization, you can notice that this is a quasi-experimental research. It will be quasi-experimental research. It could be from a well-designed case control analytic studies or multiple time series with or without intervention. So that could be your pre-experimental or quasi-experimental researches. Look at the third one. A level 3 evidence would be the one which is based on opinions of respected authorities, based on clinical experiences and descriptive studies or report of experts. So again, that would be opinions. Okay, so there is no research conducted. It's just an opinion of a doctor with 15 years of experience, an opinion of a nurse clinician with more than 10 years of experience, for example. That would only count as a level 3 evidence. So we are geared towards using level 1 evidences compared to that of level 2 and level 3 evidences. So when we are evaluating a research, we also check whether it's level 1, 2, and level 3. By the way, level 3 is not usually a research, or if not, it would be a descriptive study. Then let's talk about evidence-based nursing. What are the factors affecting evidence-based healthcare? So there are 5 here shown on the slide. 1, valid, relevant research evidence or the best evidence. So remember that we're looking into research, it should be valid, it should be relevant. Okay, when I say valid, meaning the right methodology was used. Next, judgment, skills, and expertise of the nurse. Again, I would like to go back to the example that whenever I am implementing something, as a nurse, I should be able to know, I should have the skill in implementation of this. Next, the client-patient preferences and then their circumstances. And then, are the resources available? And then the clinical decision required for evidence-based healthcare. Okay, so you need to have those 5 factors that affects the evidence-based healthcare, okay, for us to ensure the implementation of EBP. Now, the pyramid of evidence. There are several evidences available to us, and this pyramid would be able to guide us as to the levels of these evidences. As you can see, this would imply that a program evaluation data would compose a lot of evidence but is considered to be a low-level evidence compared to that of your quality improvement data, which has used some research or some statistics, okay, going up to your descriptive, non-experimental, quasi-experimental, then you have your case reports, and then you have your cohort studies, and then your RCTs or randomized clinical trials. If I would look at this pyramid of evidences, it would imply that there is a higher, okay, there is a higher, it's a higher level, okay, it's a higher level of evidence, okay, when I'm talking about randomized controlled trials. Okay, there is a higher level of evidence. Next, the characteristics of EBP in nursing. When I talk about EBP in nursing, it's a problem-solving approach to a nursing practice. It would involve conscientious use of current best evidence. Okay, look at the word conscientious. You do not use all of the evidences. Instead, it should be conscientious. Next, it involves a systematic search. So meaning it's not just a search in Google, it's not just a search in Yahoo, but it needs to be a systematic search. There needs to be a criteria when doing the search. Next, the big emphasis, as it has been, the expertise of the nurse. Next, to produce the best available evidence and to allow the client preferences and values to be heard. For example, if I'm implementing something new on the part of the patient, okay, if I'm implementing something new on the part of the patient, I need to inform the patient. This is a new intervention that has just been implemented in the Philippines. Okay, and then if the patient is expressing discomfort about this, you are not supposed to push the patient to do it. Okay, because you are always considering the preferences and values of your patient. In ethics, we call this one your informed consent. The patient needs to be informed of the benefits, the risk that they are going into, that they will go into once they will embark in this procedure. Next, research utilization and evidence-based practice. Okay, a big concern that we have, research utilization. A lot of researches happening on, but nobody's using researches. Okay, so what is research utilization? Look at the word utilize, to use, okay, to synthesize, disseminate, and use the research-generated knowledge into nursing clinical practice. It would be the one to facilitate the transfer of innovation and purposive application of research findings to current nursing practice. Okay, there are a lot of researches, for example. There are already time and motion studies. Okay, when I say time and motion studies, you observe the particular population or group of people, and then you try to observe them as to how they do the task. Now, when I talk about time and motion studies, for example, there was this study which elaborates on the ideal distance of the nurse station to the patient rooms. But there are still hospitals which are not implementing this. Okay, there are still hospitals not implementing this. So there is really a problem on the transfer of innovations. A lot of new things are being developed, a lot of new solutions are being developed, but these are not being practiced. A problem in research utilization. Now, there are different models in evidence-based practice. These models could possibly help us implement change in our organization. Take note, when you hear the word change, it's really something that most of the people would not want to do. Okay, a lot of people would stay on status quo. A lot of people would content themselves on what's used to be rather than what's more effective. That's why we have these models. So one, Stettler model. Stettler, according to her, okay, him or her, structure for using the research outcomes and suggest a vehicle for changing the policies and procedures. Her focus was on the use of research outcomes and to change the policies and the procedures. Okay, so according to her, you need to make a summary of the research done and use it to influence educational programs, make practice decisions, and then develop policies. There are several steps in Stettler model. Familiarize, preparation, wherein you identify the purpose of your search. Validation, wherein you determine whether the information is applicable and relevant to the current needs. Comparative evaluation, wherein you review the findings of similar studies. Look at the word comparative, meaning you compare it with others. Then decision making, where you consider use, and delay use to reject the findings. Okay? Or reject the findings. In other words, preparation. What am I going to search? Validation. Is this information that I have taken applicable? Comparative. Allow me to review study A and study B. Oops, inconsistent. I would make a decision. Let's not use it. Let's compare study C, study D, and study A. Oh, they are all consistent. Okay, if they are all consistent, okay, we can say that, okay, we can proceed with using this research. Next, translation and application. Okay, we translate, we apply. We are preparing to apply the research to our own practice. Okay, because you could not just read a piece of paper of research and then tell your colleagues, let's implement this. You need to have a translation process. Okay, when I say translation, it's the implementation. And then after you have implemented something, you need to evaluate. Okay, was it effective? Was it useful? Okay, was it impactful on our part? Okay, so that's your evaluation. The next model is your Iowa model. Iowa model focuses on the development of evidence-based practice in a clinical agency. According to her, in healthcare agency, there are several triggers, okay, that would initiate the need for change. Okay, so kita, no, kailangan pa ng trigger para mag-change. It's best made based on research evidence. One, knowledge-focused trigger. When I say knowledge-focused trigger, oh, there's something new. I know something new. Knowledge. I would want to change because there's something new. When I say problem-focused trigger, there's a problem. We need to change. Okay? Which is actually in nursing management, we don't want this to happen. We don't wait for a problem actually to change. But Iowa tells us that one trigger of change is the problem. Now, what are the three critical decisions in Iowa model? You need to ensure that the problem is a sufficient priority. Okay? Then, is there a sufficient research base? And then, is there change that could be appropriate for adoption in practice? In other words, is this a priority problem? Yes. If it is a priority problem, do we have enough researches to prove this? If it's a yes, then could we adopt it? Is it appropriate in our setting? If that's a yes, then you implement the evidence-based practice that you have found out. Then we have Roger's theory of diffusion. Roger. Roger would tell us the how, why, and at what rate new ideas and culture spread through cultures. I mean, new ideas and technology would spread through culture. Diffusion. Recall that when I say diffusion, it's the spread. So there are different kinds of diffusion. One, diffusion of innovations. Okay? When I say diffusion of innovations, it's the process where innovation is communicated through a certain channel over time among the members of the society, okay, or the social system. So it's the process of communication over time. It takes time. So in the diffusion of innovations, there are 5 stages or processes. One, knowledge stage. I know. That's knowledge stage. Persuasion. Okay. Do I appreciate this type of knowledge? Or this knowledge is useful? This knowledge is useless. What's my attitude towards that innovation? Decision stage. Will I use this or say bye-bye to this? Implementation stage. Let's have the new idea on board. And confirmation stage. Reinforce the decision, leading to either continuously adopt or reject the evidence. So again, knowledge, I know. Persuasion, don't like it. Decision, I'm still doubtful. Will I adopt it? Okay, let's adopt it. Implementation, during the implementation stage, I had a new idea. Something new came up. Confirmation, will I still continue to do what I do? That is your diffusion of innovations, 5 stages of process, okay, according to Roger. Knowledge, persuasion, decision, implementation, and confirmation. Then you have your Ottawa model of research. Ottawa is the use of strategies to apply innovations into practice, such as the use of evidence and other research findings in the practice environment. So Ottawa is about going into practice already. Okay? Ottawa model would have the six components. The six components are practice environment, potential research use, and then you also have evidence-based innovations. Then you have strategies to apply the innovations, the use of evidence, and then the health outcome. Okay, this is Ottawa's model. Try to look into this from your textbook. That will be all for your discussion on evidence-based practice. Once again, thank you for your attention and God bless on your pursuit.